Hello everyone. Today I'm going to discuss a very important topic, that is fever. Okay, so what is fever? It's a generally a raise or rise in the human body temperature above the normal range, that is 37 degrees Celsius or 99 Fahrenheit. So that is a fever. This is also known as pyrexia or hyperthermia. So, what are the important metabolic changes that occurs in the fever? First of all, the increase in the metabolic rate, that is metabolism rate increases at the rate of 13% for the 10 degrees Celsius rise in the body temperature, decrease glycogen stores and decrease stores of adipose tissue, that is a degradation of the glycogen from the body, increase catabolism of the protein, that is a breakdown of the protein, that places a extra burden upon the kidney, right? And more loss of the water from the body due to the increased sweating. Okay, and increased excretion of the sodium and potassium. So the temperature of the body is ultimately controlled by the hypothalamus. So what is the mechanism behind the fever? The primary fever mediator in the human body is prostaglandins. That is, in short, we can say PG, that act on the hypothalamus and that ultimately change the set point and increase the body temperature. So what are prostaglandins? These are the some of the group of the active lipid compounds. So how they are secreted and they affect the hypothalamus and change the set point by the pyrogen. What is pyrogen? It is a type of the substance that increase the body temperature, or that is the reason of the fever, is a type of the protein, maybe the some polysaccharide substance that is released either from the bacteria or some viruses or from the destroyed cells of the body that are capable of producing the fever or increase the temperature of the body. So, what we conclude, pyrogen causes a release of prostaglandin that act on the hypothalamus, which raises the temperature of the body according to the set point. So, the fever occurs. So, we can say that prostaglandins increases the body temperature by increasing the heat production. So, we can say that hypothalamus work like a thermostat that changes the or alters the temperature set point. At the time of the fever, the set point is raised, which causes the body to increase its temperature through actively producing or generating the heat. Okay, if these sufficient measures are not able to match the set point in the new setting in the hypothalamus, then shivering begins. So the muscles movement produces more and more heat to match the set point. Similarly, when the fever slows down or stops, that means the prostaglandins release ends. So the temperature set point is lower to the normal, and the reverse of this process, that means occurs. That means the sweating starts and the body temperature cool down. That means the changing to the new setting. What are the symptoms at the time of the fever? That is feeling cold. That is when nobody else does. Shivering, lack of appetite, weakness, hyperalgesia. That means uh, mm, increased sensitivity to pain.